Do you have any other messages for pharmacists? I mean, pharmacists who might be interested in developing practice in dermatology.
I would say to that is that every patient is, bear that in mind for every single patient about their skin. We all put moisturiser on our skin, some part of every day, hand cream, face cream, anything. So your patient is going to need to do that as well. So to recognise how important controlling the patient's skin is and allowing the patient to be comfortable in their skin, despite whatever else is going on for them in hospital. Their skin condition, always have a look to see if the patient is got any skin conditions, whether they're on any medications associated with skin condition, or whether they're on any creams or any injections or tablets. Always look out for that. That might not be the reason that the patient has been brought into hospital. They may have something else going on, or they've got an infection. We need to ensure that the patient's skin is catered for. Obviously, stop any immune suppression if the patient has got any infections, and always look to see, has the patient got any dermatology creams and things which will need prescribing. Get them prescribed. If we ignore the patient's skin at that point and focus on the patient's, primary concern, which is absolutely the first thing to do, and the patient's skin isn't a problem at that point, if we forget about the dermatology medicines, then the patient's skin might then become a problem and flare up. So it's really important to always bear this in mind.
Now, what would you say to people who are wondering whether a career in dermatology pharmacy was worth pursuing?
Well, I would say absolutely, definitely, yes. It's fantastically interesting, dermatology. It's not just that tube of cream that you might see sitting there on the shelf. There's so much more to dermatology than what you might think on the face of it. There's the creams and the topicals that the patient will use. There's the tablets that the patient might take. There's biologic medicines, and there's a whole load of immunology there with that as well. There's thousands of skin conditions as well, and it's just really interesting. Lots of unlicensed or off-label medication is used within dermatology as well, and specials with the topical treatments as well, because not all of it is licensed, and we go to the specialist manufacturers. So there's so much to do in dermatology, and it is really interesting once you scratch the surface of it and got more specialist and got really interested and got into it. There's so much more to do.
That's a great pitch for dermatology. Is there an organisation or interest group for pharmacists in dermatology? So if I were thinking of starting, are there people that I could talk to?
When I first started as a dermatology pharmacist, I wasn't aware of any other groups that I could get involved in that was, specialist to just a dermatology pharmacist. So I thought I was kind of the only dermatology pharmacist for a few years. And then more recently, in the last 3 years or so, I became in contact with another pharmacist, Arlene Maguire, who's in London, in Guy's and St Thomas's. So she was the first real dermatology pharmacist that I became in touch with, and we've been dermatology pharmacists for the similar length of time. So Arlene had already set up a specialist dermatology pharmacist group on the NHS networks. So that is certainly a welcome any dermatology pharmacist or pharmacist with an interest in dermatology, both secondary care and primary care, to come and join us in that group. In the last couple of years, I've become one of the members to found a specialist dermatology pharmacist network group, national on a national level. So we've had some meetings to try and aim to increase education within dermatology for pharmacists, and we held a face-to-face meeting last year. that was a great meeting to get those group of dermatology pharmacists together, get to know each other, not feel so sort of on your own, really.
And my last question, can you tell us a bit about the British Association of Dermatologists pharmacist workstream?
More recently, the British Association of Dermatologists are setting up some resources for dermatology pharmacists. So I'm part of the pharmacist workstream, working with other members of the group to set up some educational resources for primary care pharmacists, to upskill them into dermatology, more specialist dermatology area, and also for secondary care pharmacists, with some resources such as, example job descriptions, example business cases, and then signposting to some educational resources as well, and educational components that are already in existence. So signposting towards that, to be able to allow pharmacists to, or help get the pharmacists into these roles, or create this role within the dermatology team.
Marvellous to have the support of the BAD.
It's absolutely fantastic to know that they are, it's on their radar.
Kläre Bryant, thank you very much for sharing your insights with us today. That's been really inspiring. For more information about Kläre Bryant's work and links to dermatology pharmacist interest groups, please follow the links in the description. And be sure to subscribe for more news, videos and journals. For updates straight to your inbox, please follow the link below. And thanks for watching.